When it comes to the fight against COVID-19 infections, there's a new kid on the block. It's an antiviral pill that looks like this, created by a pharmaceutical company called Merck.
One way to think of it is as a Tamiflu equivalent for COVID-19.
Where a vaccine is meant to build immunity and prevent infection, this pill is meant to keep you from going to the hospital once you get COVID. Last week, the pharmaceutical company said the pill reduces hospitalizations and deaths by half in those with COVID infections.
What it does is it makes it a much more manageable respiratory infection, much like many of the respiratory infections we deal with year in and year out.
Dr. Amish Adalja is with the Johns Hopkins Center for Health Security. He's one of the two experts I spoke with about the new pill. Dr. James Nide is an infectious disease specialist, and he says this pill is a game changer.
It's always interesting to look at this in terms of what's going to save us next.
Where does this Merck antiviral pill kind of play a role with everything else that we have available to help treat COVID right now?
The hope for this new pill is that it may be more accessible. It's another tool that we have, but it in no way, shape, or form replaces vaccination.
Dr. Nide told me one of the big challenges is timing. It's most effective when people first get sick, but not everyone goes in for treatment right away.
That's why these therapeutics don't end outbreaks or pandemics or epidemics. It's impossible to predict exactly when the infection started.
This will be a prescription drug. It's going to be something that still has to make its way through the FDA process for emergency use authorization.
Dr. Adalja told me the FDA could authorize this by the end of the year. The agency has been watching clinical trials closely, but Merck's pill isn't the only treatment that's being looked at.
This is the first of probably a couple different antivirals that are going to be developed over time.
I'm Chloe Nordquist reporting.